This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Hey, good day, everyone. Welcome back to the latest edition of the Best Health Podcast. I want to thank each and every one of you for joining us once again and listening to yet another informative and very useful podcast. Hopefully you find them beneficial to helping understand about various topics related to wellness and healthcare. This episode will not disappoint. We have another great guest with us today. Just a reminder that all of our Best Health podcasts are available in the podcast store or channel of your choice, wherever you usually find your podcasts. They're also available on our website at wakehealth.edu/podcast. You can go from there and pick which episode you want to listen and listen to many of them and listen multiple times. So I appreciate everyone listening in today. There's lots of information that we've been covering surrounded COVID-19 and for general updates from Wake Forest Baptist Health about COVID-19 and coronavirus, we do invite everyone to visit wakehealth.edu/coronavirus. And there's a lot of information, as you all are aware and have seen, on the news, on social media about COVID. And we've been just lots of different topics, and there's almost seems to be a new topic of the day. And it's great to bring in our experts here at Wake Forest Baptist Health, our doctors that have been studying the various aspects of COVID and have poured a lot of time and energy into it and can speak to it from an expert point of view. So we have another guest with us today that is going to talk specifically about multisystem inflammatory syndrome in children. And you all maybe have heard about this on the news more recently and maybe have had questions about it. So we wanted to provide one of our doctors here at Wake Forest Baptist, Dr. Kacy Ramirez, to come in and answer some questions for us and help us better understand what this is and how it affects it. So welcome, Dr. Ramirez. How are you doing?
I'm great. Thank you. Thanks for inviting me.
Yeah, absolutely. We're glad that you were able to take a little bit of time out of your schedule and join us today.
Yes.
I'm going to get into some more topical questions here shortly. But before I do, I wanted you just to briefly introduce yourself to us and all the listeners and tell us a little bit about yourself and, maybe what kind of inspired you to get into medicine and specifically working with children.
Sure. So I have been with Wake Forest Baptist for about 7 years, and I grew up in San Antonio, Texas, and I went to college and to medical school there. And then my husband and I couples matched in Memphis, Tennessee. And so I did my residency and my pediatric infectious disease training in Memphis at Le Bonheur Children's Hospital and St. Jude Children's Research Hospital. And I probably became interested in medicine when I was an undergraduate in college, and I did some research in a mycology lab, which is a fungal lab in San Antonio where they do most of the mycology in the United States. And I was surrounded by many infectious disease physicians, and I really enjoyed that undergraduate research. And so I think that had something to do with me deciding to do infectious disease. But it was always, a dream of mine to become a doctor. And so I sort of figured out that infectious disease would be good for me in college, and then I loved it in medical school as well.
Well, there's been definitely a spotlight shined on the infectious disease specialty the last few months here in America and around the world, and so we're hearing from several of your colleagues, and Dr. Ohl, of course, has been doing a lot of updates for us here at Wake Forest Baptist and keeping us apprised of the latest developments. So I'm glad that the infectious disease experts, the specialists, are there like yourself and are able to help us navigate through this COVID-19 pandemic that we have faced. So like I said a minute ago, I want to dive in. We could spend hours and hours talking about different aspects of COVID-19 and coronavirus. But what we want to talk about today is really narrowing in on the multi-system inflammatory syndrome in children. And, I've seen a couple of news reports more recently about it, and I'm sure other people have as well. And, this is one of the issues that have come out of COVID-19 as it relates to children. So I guess just as a good baseline set for us, explain what is the multisystem inflammatory syndrome in kids.
Yeah, so this is a completely new entity for us. And so we have been discovering more about it as this COVID-19 epidemic has evolved. But what we have found is after the first cases of COVID-19 were being reported around the world, there was new reports of this multi-system illness in children that we have become more and more aware of. And so what it is probably a spectrum of COVID-19 related disease.
Okay.
But it's hallmarked by severe inflammation, which generally causes three things in children. So the first thing is fever, for 1 day to up to a week, and inflammation, number 2, which is immune system activation. And we'll see that supported in blood work that the children get. And then most importantly, the third thing is called multi-organ dysfunction, meaning they will have involvement of at least 2 or more different organ systems, which is caused by this immune system activation or inflammation. And so clinical features come from the organ that it affects. And so a lot of times there is GI tract involvement. So children will present with nausea, vomiting, diarrhea. And it can affect the heart. And so in this case, there might be some damage to the coronary arteries. Those are that is the blood supply to the heart, which will then affect the heart in its function. And also the heart becomes affected and the muscle doesn't pump as well, and they will get sort of problems with maintaining their blood pressure. It also affects their blood system, and so their blood counts will go low, their platelets will go low, their glands will swell in their neck, and they may have bleeding or clotting problems. But what's new to it is these mucocutaneous syndromes. So that is involvement of the skin and mucous membranes. So we'll see changes to the skin, like rashes, which could be all kinds of different rashes. And then mucous membrane means redness sort of to the eyes or the mouth. And then they can also have changes to their hands and feet. So they'll get swollen red, tender hands and feet. And so those are the mucocutaneous changes we see. It can also affect the brain. And so they'll be confused, very sleepy. They might have a headache. And so those are some features as well. And so other organ system are kidneys and the lungs. So they might have some evidence of cough and trouble breathing, but that's sort of less common than, say, COVID-19 in itself. Okay. And so in addition to the 3 things that they have, which are fever, inflammation, and multi-organ dysfunction, they also have some association with COVID. So they might be positive for COVID by PCR of the nose. So they'll swab the nose when they come in, and you find the virus in the nasal passages. Or they will have a positive blood test for COVID, meaning in the past they've had COVID and now they have an antibody to COVID. And if that's not the case, then at least they have a history of exposure to COVID within usually the past 4 to 6 weeks. And that's sort of what hallmarks MIS-C. Now, this whole syndrome can also appear similar to many other diagnoses. So we also want to make sure that it's not other things that it mimics. And so we often get a lot of people involved to make sure that it's not other things like Kawasaki disease, Rocky Mountain spotted fever, which can follow tick bites, other viral infections in the summertime, and another entity called toxic shock syndrome. So there's several components to making the diagnosis.
Gotcha. You brought up Kawasaki disease, and I've heard that mentioned a couple of times in relation to this syndrome. Are they the same thing, or are they not the same thing? Why do people reference Kawasaki disease as it relates to MIS-C?
Yeah, so this is a great question, because Kawasaki disease is a vasculitis, so it's an inflammation of the blood vessels, and it usually follows probably some infectious trigger. We don't really know what it causes or what causes it. I'm sorry, but it presents with specific features.
Yeah.
And so it's a little different. This MIS-C is different. So MIS-C, a recent study has shown from the New England Journal of Medicine that included about 186 children. They showed that about 40% of children presenting with MIS-C had some features of Kawasaki's disease. And the features of Kawasaki's disease are obviously fever, but redness to the eyes and mouth, and rashes. So that's that mucocutaneous component, and then swelling, say, of the lymph nodes of the neck, and extremity changes. And this is after several days of fever. But the differences between the two entities are the patients with MIS-C generally are older and encompass a broader age range. So Kawasaki's disease primarily affects children that are less than 5 years of age. Around the age of 2, MIS-C, the average age is about 8 years of age. MIS-C is also appearing to occur more often in African American or Hispanic children versus Kawasaki's disease, which occurs more in Asian children. MIS-C patients are presenting with more GI symptoms of diarrhea and more neurological symptoms. And they're also more likely to present in shock and with cardiac heart failure, or cardiac dysfunction, I should say. So in Kawasaki's disease, that only happens about 5% of the time. MIS-C, this is happening in almost 50% of the patients. The heart is pretty severely affected. Yeah.
So when you say neurological issues, is that like a tingling or
no,
pain or?
No, it just seems to be confusion, sort of headache, more sleepiness, even sometimes signs of meningitis. That doesn't tend to be a common presentation of KD, but it can occur. MIS-C also, they have labs are different. We've found that they have lower platelet counts, lower white counts, and higher markers of inflammation, which is measured by a level called CRP, or C-reactive protein.
So what if you're talking to a concerned parent and their kid presents with some of these symptoms, and what would you say causes MIS-C? Is there a definitive cause, or are there multiple causes, or what information would you give to a parent?
Right now, we don't know what the cause of MIS-C is, but it's probably connected to COVID-19 in some way, and probably the infection is triggering the immune system in some way. And so it's probably a post-infectious or peri-infectious, meaning you get MIS-C after or during the infection with COVID-19, and the immune system's activated, and it causes disease in multiple organs. And most of the time we're seeing it following actual COVID infection after about 25 days, but about 4 to 6 weeks after COVID-19.
Interesting. I know you've gone over a lot of the signs and symptoms and talked about, how it's related to COVID-19. And COVID-19 is we hear about more cases each day, and it can affect people of all ages, including children. And there's also out there, as you've mentioned, is more common, colds and viruses and a stomach bug, and this infection and that infection that kids usually get, that they catch something either with their friends or whatnot. So when should a parent maybe contact their pediatrician for their kid if they're having, some of these symptoms? Should they go straight to the emergency room, or if they just contact their pediatrician? What would you recommend?
Yeah, so I think that any child should go to the emergency room if they have any really severe neurological symptoms. So they're confused, they're sleeping too much, you can't wake them up, they're having seizures or weakness on one side of the body, stiff neck. If they're too dehydrated, if they look like they're not eating and drinking enough to stay hydrated, or they're having excessive nausea, vomiting, and just not eating, they should go. Obviously, if they have any chest pain or loss of consciousness or trouble breathing, they have to go. But really, if there are signs of fever for more than a day, if they are having some diarrhea, vomiting, they're starting to see changes in the child's eyes, in the lips, in the hands and feet, or the skin, they're sleepy, they have a headache, they have cough, anything like that, they could call their doctor and ask them, do they need to be seen? And an exposure to or a history of COVID really should be emphasized when they're calling the physician. And if the physician says, yeah, go ahead and come in and you don't need to go to the ER right away, then, and if they look pretty well, they can be seen by the pediatrician. The pediatrician should do a good look over. And the next step they would do, if they were concerned for MIS-C, based on history and symptoms, would be to do some lab work. And if those labs can be done in a pretty quick turnaround time, then they can get some basic screening labs done. And if those look pretty reassuring, then, it's possible they could get follow-up the next day with the pediatrician. But if anything's abnormal, then that's when they would decide to send them probably to the emergency room.
Okay.
Yeah.
So with the diagnosis, is that's the main, doing an assessment on the child and then doing the lab work. Once they see the results of the lab work, they're able to make a diagnosis of MIS-C or rule it out?
Well, they wouldn't know at that time, and they would then send them to the emergency room to do even a second step of even more exhaustive lab work and maybe even an echocardiogram. So sort of step 2, lots more labs happens once they're in the emergency room. And then based on that and multiple subspecialty involvement, and there's a lot of labs that happen, then we come together as multiple teams, multiple subspecialists, and try to decide if that's what this child has or not.
Gotcha.
Because it is a difficult decision to make.
Okay. I gotcha. So then that would be how a diagnosis happens with this kind of comprehensive approach.
Yeah.
Which is good to hear. So, and I think you've touched on, some of the dangers that MIS-C could have with it, especially with the neurological and the cardiovascular issues that needs to be addressed for sure. Speaking of addressing it, let's say that your multidisciplinary team at Brenner Children's does diagnose someone with MIS-C. So now what? What's the next step for treatment and recovery?
Yeah. So if, I'll emphasize that really the heart is what is most affected here in these children. And so we get a very quick cardiology assessment. And if there is a need for blood pressure support, then that happens very quickly. And then hopefully finding an epidemiological link to this infection and detecting COVID or getting a positive antibody test is usually what we see. It does support the diagnosis, but we sometimes can't wait for that. We make the diagnosis before we get the COVID test back. And if they have all the signs and symptoms, then in an exposure, we treat them as if they have this syndrome. And so the treatment is really based on suppressing inflammation and that inflammatory response that's happening in the body. And so our rheumatologists are the experts here in determining the best treatment for them. And we tend to, particularly the ones that have Kawasaki's disease features, will get IVIG, which is immune globulin given through an IV. And that's an anti-inflammatory medication. So almost all of these children are getting IVIG and then steroids. So there's different steroids that we're using, but methylprednisolone and steroids are sort of the mainstay of treatment, and other anti-inflammatories that the rheumatologists are experts in. They will use those different drugs depending on the situation. So anti-inflammatories are the key. And if they come in with an actual positive respiratory test and they're having signs of COVID in their lung or COVID virus in their lung, and they're needing a breathing machine and things like that, then we consider an antiviral. And we might use that in their case. But most of the time it follows an infection with COVID, and they don't have a ton of respiratory symptoms, but they can.
Gotcha. So, does it take a really long time to go through this process and get back to 100% feeling better? Usually what do you tell families as far as the timeline?
So the earlier they get steroids, probably the better in their case. And the average length of stay for patients has been about a week.
Okay.
And, the survival rate is about 98%. So only 2% of patients at this point are succumbing to this inflammatory syndrome. And so generally they are surviving.
That's good. Well, we're going to wrap up here in a minute. And for everyone listening, we're talking with Dr. Kacy Ramirez. She's an infectious disease expert here with us at Wake Forest Baptist Health and with Brenner, and talking about multisystem inflammatory syndrome in children specifically, and the different ways that can affect the body. What's the best way to, I guess, a parent goes to, well, how do I keep my child from getting this? What do you have advice on ways to protect children from getting MISC to begin with?
Sure. So, we don't know what the trigger is, but we think it might be associated with COVID-19 infection. And so reducing our risk of exposure to COVID-19 are what we really should aim to do. It's still a rare complication of COVID-19, so just keep that in mind. But I think what we really need to do is, before we venture out the summer to non-essential activities, we just need to sit back and think about, well, what I'm about to do going to be a risk for me and my family? Is it going to be a low risk of exposure to COVID or a high risk? And no matter what the answer to your question is, can you justify that risk in your own lives? Or do you have a special person at home who could get very sick with COVID? And, you think about those things and you talk about that with your pediatrician. But ultimately, I think we should probably limit our gatherings, our events, and our extracurricular activities, to those that we can safely maintain social distancing. We can support proper hand hygiene. We restrict attendance, high attendance numbers, and restrict attendance to those from higher transmission areas. And social distancing means really staying more than 6 feet away from us outside our household, and staying home when we're sick, avoiding lots of people for long periods of time. And prevention includes washing our hands, wearing our face mask in public,
yes,
and avoid touching our face. And so those are the things that we should be considering as we venture out this summer.
Okay, so all the PSA information we've been hearing to help stop this slow down the spread of COVID, with especially wearing a mask, and then washing hands and social distancing. That's going to help us curb the MISC as well. Sounds good.
Yeah.
Okay. Well, that is a good reminder, as always. We'll take that advice of the washing hands, wearing a face mask, social distancing. We'll repeat that as much as we can and as much as necessary. So, this has been great information, Dr. Ramirez. I really appreciate you taking the time.
Yeah, sure, of course.
So, as we get further information about COVID and specifically, MISC, further down the road. We hope that you come back and visit us at some point in the future as well.
Great. I would love to.
Okay. Well, hey, once again, everyone, thank you for listening. We appreciate you taking your time to learn more about this as well. And another reminder, you can visit all the COVID-19 related podcasts that we have at wakehealth.edu/coronavirus. I will say, if you have any concern or you might have questions about, one of your children or someone in your family related to COVID-19 or MIS-C, please contact your primary care physician. You can also call 336-716-WAKE, and they'll get you pointed in the right direction. There's also information on that URL I just gave, the wakehealth.edu/coronavirus URL online as well. So another reminder too that our COVID hotline is still active. People can access the COVID hotline 24 hours a day, 7 days a week at 336-70-COVID as well. Appreciate everyone listening. Dr. Ramirez did a great job. Hope you come back and visit us again sometime soon. And until we chat again, everyone, I please wish you to be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.